Hello to everyone watching. My name is Matthew, and I'm going to do a quick presentation on nurse practitioners. So an NP is considered an advanced practice registered nurse, and they are more akin to general physicians than they are to actual registered nurses, I would say, due to the responsibilities and tasks they take up throughout the day. They can prescribe treatment, prescribe medication, diagnose and treat illnesses. They are also in charge of proctoring and interpreting diagnostics tests. They also go ahead and provide counseling and education for their patients in order to really provide a more holistic healthcare provision for their patients. There are a lot of specialties within nurse practicing, including pediatrics, women's health, oncology, acute care, orthodontics, widespreading throughout the healthcare industry. And they all pretty much work within a clinic or a hospital and have 9 to 5 typical 40-hour week work weeks. A lot of them have their MSNs, so Masters in Science of Nursing. However, as you can see here from the chart, about 18% have their doctorate, and that's a growing figure according to the AANP, American Association for Nurse Practitioners. They're saying that there's going to be a bigger need for more NPs that have their doctorate, as it's an expanding field. Most nurse practitioners got there by first getting their RN BSN through a 4-year program, and then completing the NCLEX and becoming a registered nurse. After that, maybe working after a little bit as a nurse, they go ahead and apply for a BSN to MSN program, which takes about 2 years, or a BSN to maybe a DNP program, which takes about 4 years. So now you're looking at 6 to maybe 8+ years of college education, in which afterwards they'll have to take a certified test, which will then make them a bona fide nurse practitioner. There are a lot of routes that you can take. Many people will actually have bachelor's beforehand and then go ahead and get into an MSN program and become a nurse practitioner after having a bachelor's in non-nursing field. NPs make about $111,260 per year, as compared to the California national average, which is about $143,000 per year. I knew I wanted to become a nurse about a couple years ago, and then after looking into it over time, I realized I really wanted to get higher education above just a bachelor's degree. And so I figured out that there are specialized positions for nurses who want to go ahead and become more educated and provide better care for their patients. And so I fell in love with becoming an NP, and I'm really excited to getting into a program. Some top programs around the country include UCSF, Duke, Johns Hopkins, a lot of the big Ivy League private schools. And other than that, I want to say thanks for watching, and see you on the flip side.